Hi, I'm Steve from Physio for All. And today we're going to just go through a couple of stretches with Katrina for her neck. So anyone who has neck stiffness, neck tightness, headaches, any upper shoulder or upper thoracic spine stiffness, these stretches are pretty useful. The first thing we'll do is just get Katrina to go through her normal ranges, because this in itself is pretty useful. So what I'll get her to do is just go through some flexion, hold, come up into extension, and then come back to neutral. And that's useful to do maybe 4 or 5 times. Something we never do is go back into extension, which is pretty useful because we never take our necks back, we're always looking down. So that as a warm-up or a decompression type exercise, just to move the neck, is very useful. Then doing some rotation to full range, come back, full range, and getting someone to do that a few times, also very useful. And the last little warm-up, side to side, and come back up. Very important to make sure that someone's well postured, they're not slouched and hunched over, and they're relaxed through their shoulders. Now, just a couple of nice stretches. I'm going to get Katrina to put her left hand on her right ear. So just come up there and just to stretch across. Now the important thing is you don't want someone dropping across. You want her to sit up nice and straight and just get a nice stretch through that area. Hold the stretch for 10 to 15 seconds. Don't pull your head off your neck, so it's not a massive pull, just a nice gentle stretch. You can get Katrina to, or your patient or client, to sit on her hand, which will give her more of a stretch as well. So that's a really nice stretch to do, and you would do that to both sides as well. All right, and the other stretch is, let's straighten you up. You rotate the head there. Again, left hand straight down and stretch. And again, a slightly different angle. Make sure that she's nice and upright, that she's not slouched over. Getting a nice stretch through this area right up into the back of the head. And again, you can get Katrina to sit on her hand, or your patient to sit on their hand, and you can get a nice stretch there. And again, I would hold that stretch for 10 to 15 seconds and repeat it to both sides at least 2 or 3 times. Okay, let's get Katrina to sit up now. And the last very useful exercise is we tend to spend a lot of our time with our chins poked or in a forward flexed position looking down. So what we're going to get Katrina to do is a little bit of a chin tuck, where she just gently draws her neck back in and holds that position. What she's then doing is opening up all the joints and stretching the tissue structures at the back and activating the deep neck muscles, which we tend not to use a lot of. Relax completely. And again, we tend to be a lot out there, and we really want to aim it. So as a self-exercise, you can get your client or patient just to tuck the chin in. It's almost like a small nod. Open up the back of the neck, hold for 5 to 10 seconds, and release completely. What you don't want is a lot of tension in the neck. You can see Katrina's doing it nice and gently. She's not over-activating all these muscles. And again, you want to try and repeat this 4 or 5 times, at least 2 or 3 times a day. Thanks. This is Steve Felsher from Physio for All. Revitalize, bounce, be healthy.